but you want to show them. News on TV, on Facebook, and on Twitter. We will be glad to share your thoughts with the rest of the world. Once again, you're welcome. My name is Francis Aben. Now, it was implemented at a time majority of Ghanaians were calling for quality healthcare, but after years of its implementation, some Ghanaians are already disenchanted in the National Health Insurance Scheme. But Health Minister Alice Segbefia says the woes of the NHIS can be attributed to the exponential growth of its subscribers. This, he says, has ballooned the amount the NHIS has to pay in claims. He's however hopeful that a review of the scheme, which has already started, will save the scheme from its current situation.
It's clear to me that from the National Health Insurance that actually the scheme has become a victim of its own success. But we are a victim of our success because of the numbers we are dealing with. We are paying almost 1 billion in claims at the moment. When we took office, we were only about 300 and something million. Sorry, 189 million. We are looking at 5-fold increase. It was clear that the exponential growth has created a problem. And for that reason, it has meant that we have had to review the scheme which has been done. The documents are now heading to the presidency. They will look at it, and subsequently, as I said, we will be able to review the position that we are in.
But Dr. Matthew Poku-Prempeh, who represented the NPP on the health debate earlier today on the Super Morning Show, believes that the Ministry of Health has not set its priorities right, the reason for which the numerous agitations we have seen in the years in the health sector.
It's more expensive to get into a nursing training school than go to a university. Under his watch, particularly. Not under any other Minister of Health. Under his watch. Nurses will have to pay about 4,000 Ghana cedis. Even the universities don't charge that much. You've cut their monthly allowance, and you are saying you're going to promise them what? Students' loan scheme. When the allowance was about 400 to 500 cedis a month, and the loan scheme the whole year is about 1,600. Why are you robbing Peter to pay Paul? And in this same ministry, they oversell forms to students who want to go into nursing training institutions. The oversell is that they have mounted millions. And what does the ministry use it for? Not even to plow it back into the training institutions, for especially when their budget was cut, administrative budget was cut so much. They decide to build MOH-TV, buy cars. This is the ministry that hasn't got its priority right. That's why there's so much agitation in the health sector.
So that's for the health debate that happened earlier today on the Super Morning Show. Clearly, we'll be having more of such conversations as the days draw near to election 2016. Various sectors will be looked at. But after the short break, we'll look at something to do with the Accra Psychiatric Hospital. It's beginning to look like though the crisis is reaching neck-breaking proportions. Details after the break. We'll bring you a special report, plus get to speak to those who are largely affected by the lack of logistics. You're still watching The Pulse on the Joy News channel on Multi TV. Now let's head to the Accra Psychiatric Hospital, where we are learning that trouble is brewing. In fact, the nurses there have embarked on a 1-week strike, and it's all because of the lack of logistics to work. I'm talking food, medical equipment, drugs, and all the supplies they require. Jifakege, my colleague, has been to the hospital today to find out what's happening and has come through with this report.
The atmosphere at the Accra Psychiatric Hospital seems rather quiet than usual. This is because the nurses are embarking on a 1-week strike action. Though they are present at work, they have refused to render services to patients. In an interview with Joy News, the spokesperson of the Psychiatric Nurses Group, Philip Frimpong Ochri, says lack of logistics and even medical supplies makes it impossible to take care of the patients.
We have written to the hospital management, we have written to the mental health authorities. And then the response we got from them is that they have also proceeded to the Ministry of Health, okay? And then all they are demanding from the Ministry of Health is money, but they have not been able to get the money from the Ministry of Health. So that is why they are also not able to provide what we need to take care of the patients. Now, what we are facing is that we don't have access to essential medications to manage these patients. Secondly, we do not also have access to basic logistics to carry out our professional duties. For instance, we don't have gloves, we don't have spirits, we don't have detergents. And then the food we serve the patients to are willfully inadequate. And then these have become the major source of aggression towards staff. So our decision to put such measures in place. We have duly informed the authorities that if by Friday we have not seen what it takes to work with the mental patients, we are going to declare indefinite strike. So they are in a very well known.
Attempts to talk to some stranded relatives of the patients to share their ordeal with Joy News failed. However, the psychiatric nurses are giving authorities 1 week ultimatum to heed to their call, else they will go for an indefinite industrial action.
So that's just a quick wrap of what's happening at the Accra Psychiatric Hospital. Pretty difficult situation, but let's speak to those who work daily there and what their concerns are as regards why they cannot offer their services for 1 whole week, which they seek to escalate to go indefinite if nothing is done about it. Genevieve and Frederick join me in the studio. They are all members of the Psychiatric Nurses Group. They work there at the Accra Psychiatric Hospital. Thank you so much, ladies and gentlemen, for joining us today.
Thank you.
Genevieve, I'll start with you. You work there at the hospital. What is the problem? What's happening for which reason you've now decided to stop working till these issues are fixed?
Thank you very much. As it stands now, we are short of medications. We also lack basic logistics such as gloves, disinfectants, and then A4 sheets, pen, notebooks, and the others. And then the patients also lack adequate food. And as you know, all these things...
Okay. Genevieve, if you could just speak up a bit so we can hear you loud and clear. Yes, you're saying.
Yeah. And then, for instance, shortage of medication. The medications are what help the patients, especially the aggressive ones, to calm down. Mm-hmm. So you can imagine when there is shortage of medication in the hospital, patients will become aggressive.
For how long has this been going on?
It's been going for about 2 years now.
For 2 years?
Yes.
And for this 2-year period, what have you been doing to keep the aggressive patients normal or subdued?
Our managements often go out there to solicit for funds, to ask for donations from benevolent societies and all that. So it's been in and out like that. You know, we cry out and the government brings something a little and then just for a period, and then go back to the situation again. Okay.
Frederick, yes, we know what the problems are with the very little logistics or next to nothing at all. But how is it affecting your work as a nurse?
Let's even take the patients who were almost well enough to be managed at home. Because of the shortage of medications, most of them are relapsing. And for that matter, it's even expanding their stay at the hospital. Aside that, they are getting aggressive day in and day out. And even with the issue of food, most of the time when the food comes in, the quantity is not sufficient for the number of patients we have at the moment. So most of the time you serve somebody the quantity, the person will instruct you, add more. Sometimes they even throw the food on you because the quantity isn't sufficient for them. And all of this brings a whole lot of aggression towards us.
Okay, now when you say aggression, people know the word aggression, but how does it play out practically when you're working on these situations? Give me real life examples.
A typical example: serving a patient food and he tells you the quantity is so small and therefore throws the food on you. Hot food.
Okay.
The person can
hot food.
Yep. Hot food. The person can even spit on you, verbally abuse you, sometimes giving you blows. My lip is like this because of similar shortage of medication in the past.
Well, you were beaten up by
I had a heavy blow from a patient. I nearly lost a tooth, and for 2 weeks, all I could take is just liquid foods. If I should take anything solid, the sensation, my brother. So we just don't want to get there. Again, as I speak with you, some of our colleagues were injured.
When?
A colleague just somewhere last week was attending to a patient, and then the patient threw their leg to hit the stomach. Unfortunately for this colleague of ours, had a previous CS. So the blow or the
CS is cesarean section. Had a pregnancy.
Yep, and cesarean section was done for this lady, and then the person has reported to work. This lady threw the leg to hit me while this person was just feeding you, because you need the food as well. And the leg landed where the CS was done. Apparently, it got ruptured again. He has to go back to the theater for the thing to be researched. So this is some of the things we are going through. A colleague at the other side, a male ward, was attacked. Even the reception had their fair share of it. And it's been happening all over the world. And sometimes when the patients come in, they are mostly in handcuffs with police escorts. Sometimes, if not police escort, they are tied up. Now, when they get in, the very things we use to take care of the patient, i.e. the gloves, the cotton, the medications, are not there. So what do we do now? The very things we use to take care of the patient aren't available. This is the situation we find ourselves in.
Now, what I find curious is this. For 2 years straight, this has been the situation. How bad has it become? For which reason now you say, look, guys, enough is enough. You've raised your hands.
I think some years back, either a year or two ago, we had a similar demonstration demanding for medications and what have you for our patients. And then something small came in. But unfortunately, as the situation is now, it's really worse off. Because the last time we checked from the pharmacy, the quantity of medication left for both the inpatient and then the outpatient is just 8%.
8%?
8%.
What does that mean? I mean, what does that mean
Let's
for anyone?
paint a critical picture. Those inpatients, like those already in the wards, are about, say, 400 to 500. And then we have those who are well and at home and come for reviews and still demand on the same.
Let's first talk about those who are in.
So with those about 400 or 500 patients in, the medicine left to take care of them is just a handful. And even not all the medicines we need, just a fraction of a few. And it is not the same medication that those outside come and share with those inpatients. And sometimes the situation becomes so worse that patients who are supposed to take medication, say morning and evening, are not given at all. We had a case at one of the wards where a patient has not been on medication for some time, eventually got angry and had to lock the gate, one of the largest wards in the hospital, locked the gate, and it took the staff in there more than 5 minutes just to calm him down because the medications aren't there. So you have to now restrain this person physically. And in all of this, we are not just fighting for ourselves, but our patients as well. Because in as much as the patients get aggressive and then they attack us, there are weaker patients around. And as and when they start hearing voices and seeing things, they will start attacking themselves. And the outcome wouldn't be nice.
Genevieve, Freddie speaks of the effects, but you as a worker, you clearly have your concerns. For these past 2 years, you've managed to handle this. Are you also giving up already?
Yeah, I'm about giving up. You know, you cannot negotiate your safety. And then I've had my fair share of the attacks too.
What's your story?
There was this day that I work at the OPD reception. So I was just behind the reception door and an aggressive patient was outside the door. We realized he was aggressive, so we locked the door. He used his leg to hit the middle part of the door, which came off and landed on my shoulder. I nearly dislocated the shoulder. It was really bad.
And how long ago was this?
That was, I think, 2 years ago. It was really bad. What I could get from the hospital management or from the hospital was an excuse duty. The hospital bill I had to bear myself. So it's really bad.
So it's not just about the drugs needed for the patients. Even for you who get injured, in the course of this, nothing is done for you.
Nothing is done for. There's no risk.
There's no
allowed,
protection
there's no
for nurses.
insurance,
Nothing.
There's nothing.
I have taken care of myself 3 times. And as I speak with you, I still go to 37 to take care of my eye. Because the patient gave me a blow on my eye.
I don't mean to be insensitive, but with all of this, you still want to do this job?
Yeah.
There's a perception out there that people would only get to the psychiatric hospital when they go in to smoke or drink, but it's never so. You and I can easily break down with life stresses. So somebody has to be there to take care of them when they need to be. And we've been trained to do what we do. In every occupation, there are 1 or 2 hazards here and there. And in our case, it's a special case. And even when the medications are available, we still go to some of these things.
So, yes, your concerns are clearly established. We know what they are. Over the past 2 years, what has been the responses you've been getting to this?
Like my sister was saying, I think a year or so ago, the government gave the 3 psychiatric hospitals some money to take care of some of these things. And then we had suppliers who were supplying us, even though we were owing them, they were still supplying. But along the line, they have also stopped. So that's what has come to...
Do you know why they've stopped?
Apparently, we are owing them.
How much?
The last time I checked was about 4.1 or so, and we paid them something small. I think just recently we were giving 500 or so to take care of that. So as we speak, we are still owing about 3,000 or so plus. So if I owe you such an amount, you wouldn't continue to supply me, because for all you know, maybe you also go to the banks to go and borrow. And I don't know, day in, day out, your interest. Even common disinfectants that we use to even clean the wards.
You don't have
I'm not there.
And what's management saying about all of this? Because yes, you may be the workers who may need these things, but what's management also doing about the situation?
We had a meeting with management as well as the mental health authority, and they are also handicapped. Because Dr. Kwesios, the CEO of mental health authority, was saying that. So the LI is passed, which would give power or teeth to the mental health authority. There's nothing they can do. And as we speak, he says nothing has been given to them. So if they don't have, they can also give to us. So I don't know, they have to come back to government. Because per the LI or the act says the care of the mental ill should be free. So if the government has passed such a law, then government should be ready to provide the logistics.
To foot the bill.
So
now you're going on this 1 week strike.
No, the 1 week is sit down. We are at the work premise. As we speak with you, you are coming from the work.
But you're not working.
We are not working because
so point is, it's a strike.
Yes.
Whether sit down or standing up, it's a strike.
But from next week, we wouldn't come there, because at the end of the day, when we come, there's nothing for us to work with.
Okay, let me quickly pick the thoughts of, let me try and get a response from you, from Tony Goodman. He speaks for the Health Ministry. Mr. Goodman, thank you for joining us today. Okay, I think we've lost him on the line. We'll try and re-establish contact and then get some responses for you. But you say that this strike is important to get government to listen to you. But have you even written to the ministry, spelling out your concerns and why they should address it urgently before you take this action? Because withdrawing your service means that for these aggressive ones you speak of, they could be doing it just about anything as we speak.
Thank you. And mental health issues are national security issues. And over the years, it's been neglected. Even the society out there don't see the essence of mental health. And that is why we've gotten to where we are. That is why we are where we are today. The question I always ask myself is, each year the government allocates some money to the health ministry, and then the health ministry forwards it to the various institutions. I'm sure Accra Psychiatric Hospital is on the list of the ministry as an institution for the government.
But not sure. Okay.
And for that matter, the money is to be given to that.
Hold that thought for me, Frederick. We have Mr. Goodman now on the line. Tony Goodman speaks for the Health Ministry. Mr. Goodman, thank you for joining us. Mr. Goodman, good afternoon to you. Mr. Goodman, good afternoon. It looks as though we don't have him on the line. It's either he can hear me or the line is pretty bad. We'll try and re-establish contact with him and get some response, because clearly these nurses are on strike because they need their tools to work and even the insurance to take care of the patients, which some of them are aggressive. You've heard their own personal stories about this. But I was talking about what you've done in reaching the health ministry, because it's one thing taking an action to strike. What you provide is an essential service. What have you done about it?
That is why we wrote to our immediate employers, and they report to them. We've been in verbal discussions with them over the period.
Okay, Frederick, let me hold on for just a minute. Mr. Goodman, good afternoon to you.
Good afternoon, my brother.
Great. Mr. Tony Goodman speaks for the Health Ministry. So we have the nurses from the Accra Psychiatric Hospital tell us their concerns, for which reason they are on a 1 week sit-down strike. Do you know what their concerns are?
Good afternoon to our viewers and listeners. For the benefit of radio and TV, I can say yes, we've heard their concern and we are aware of their concern. It's in relation to logistics, financial resources also, and other essential medicines they requested from the mental health authority to be able to take care of their patients.
And what are you doing about these concerns, Mr. Goodman?
We've spoken with the mental health authority. Clearly, you should know that when it comes to Accra Psychiatric Hospital, they don't fall directly under the Ministry of Health. They fall under the mental health authority. And we've gotten an indication that they are run out of medication. And so we are looking at making sure that we provide some through the mental health authority.
But Mr. Goodman, this problem has been around for almost 2 years now, and they speak of the authority not getting the needed funds. You've been aware of this for 2 years, haven't you?
You also aware that just recently the ministry sent some resources to that hospital What it means is that what you need as a country is a dedicated source of funding. This is what we all are working towards currently. In the past, government takes 100% care of patients in there. So today, and what all of us, including various stakeholders, agreed on is to have some fund dedicated for mental health. Because if you budget for an amount of money, government will make that amount readily available for you. But will that amount of money be able to take care of the other expenditure, other costs you may want to embark on there? So the Mental Health Fund or the Mental Health Act has actually identified this sort of funding. Just recently, Dr. Kwesi Osei and his board actually met with the officers from the Finance Ministry, and they've agreed on a dedicated source of funding which will now solve this perennial problem we've been facing in that.
And that takes effect when?
It's something that will have to go through another process, which is it has to be included in the airline, goes back to Parliament for it to be approved. You know, when it comes to actually getting money from a particular government source, it has to go through Parliament. So all of those things have to be done before you get some money to take care of that problem that we've been having all these years.
Okay, Mr. Goodman, much as that has to be done, which I understand for the legal process, what happens as these nurses are unable to take care of these patients? They are becoming more and more aggressive, they're being beaten up, being injured. What do they do?
We've gotten this communication from the Mental Health Authority. So the minister is actually in talks with his colleague at the Finance Ministry to see, before we get these funds coming in, what can we do in the interim to resolve this problem? That is what we are actually looking at currently.
So how soon will they get the funds to get the job done?
As soon as we are able to get some resources from the Finance Ministry, we make them available.
Will that be available by the end of this week? Because the nurses are on a 1-week sit-down strike.
We are hopeful that we will make sure that particular sector does not face any close down, or these nurses will not go through the danger of taking care of patients.
Okay, well, the nurses are here. Let me just pick their thoughts as to whether they are satisfied with this and maybe might call up their strike. Frederick, are you convinced? They said they are working on this. By maybe close of this week, you may get your money.
Even from what he said, that some of the airline issues would have to go through process. And you and I are here. We know how long that might take. As soon as practicable, we need a medication. Without it, we can't work. Without the basic logistics, you give us the medication. Without gloves, without the cotton, how do we work? We just need the very things to work. So if the things are not there, we can't work.
Mr. Goodman, they say no logistics, they can't work.
Yes, the logistics it mentioned, these are things that happened just recently. We had enough medication for patients until recently. So it shouldn't look as if we didn't have medication. In the past, we were dealing with food supply and not medication. Government has been taking care of these patients this far. The problem we've got just recently is in relation to food and not medication. So let's put that in perspective.
Well, they're here. Let me just make their thoughts. Is that what the situation is?
The issue has to do with medication and then the quality and quantity of food.
Well, so the quantity of food which he says they've been dealing with for a long time, has there ever been a problem? He says it has been regular, so the Mental Health Authority took over.
Just a year or so ago, we were on the news again demonstrating for medication and all those things. It was then something came to take care of it. So it's not as if something that has been taken off completely. Like he rightly said, the issues are there, just that maybe we just massage it as and when, and then we brush it off. But where we've gotten to now, our hands are tight.
So, Mr. Goodman, the patients don't have enough food to eat, the drugs are not in, the logistics are needed. You're saying end of this week they will get it?
I didn't say the end of this week. I said we are in touch with the Finance Ministry. Now get some resources ready, we've made them available to them.
So from now till then, what do the nurses do?
We actually sympathize with them, because if you are taking care of people who are aggressive, you need some medication to calm them down to be able to take care of them. We are actually in this together with them. But I can say that we, as far as we are concerned, we ran out of medication just some few weeks ago. So we started working towards buying this medication before they actually threatened to go on strike. So my assurance to them is we will make sure we provide this needed logistics for them. We share in their frustration and we'll deal with it.
Finally, we know you've just before I let you go, Mr. Goodman, you've just released a statement on the gospel strike. Give us the details. What is that about?
Oh no, it's just to commend gospel for calling off the strike whilst they go back to the negotiation table. Maybe most of us may not be aware that they've called off their strike. We are currently back at work, and as for us in the ministry, the only thing we look out for is to remind them that we are actually talking to gospel the other condition of service which we have to do as a ministry. Will look at that and also resolve it. But we are grateful to them. We commend them for coming back to take care of patients.
Mr. Goodman, thank you for your time. He speaks for the Health Ministry. So Frederick and Genevieve, you've heard what the Health Ministry's position is on this matter. You look very disappointed. Genevieve, you're not happy with what you just said.
I am not, because as he said, they are working, you know. In the meantime, what do we do? Like you rightly asked him. We don't know. He said they are hopeful by the end of the week. We just started the week. So tomorrow anything can happen. In an hour's time, a patient can attack a nurse. In an hour's time, a patient can do anything. So in that meantime, what do we do? Our hands are really tied here. So because medications and the basic logistics and the inadequate food all lead to aggression. And aggression towards the staff, aggression towards the patient themselves or any other worker on the compound.
If you had your way, you will abandon work, wouldn't you?
It is not our desire.
No, but looking at the way things are.
Looking at the way things are, our safety is important.
So for that reason, you just might say tomorrow morning that, look, I just don't want to go risk it. I won't go today.
We don't want to do that, because look at the kind of patients we are handling. Should we even abandon them for just a day, the outcome will be disastrous for virtually everybody in this country. And that's exactly what we are trying to prevent. So even today like this, we have to now call on our OPD nurses to help in the various wards where the aggression is so high, to help. We are doing all we can, but the situation is just getting out of hand, day in and day out.
Okay. Frederick and Genevieve, thank you for coming. Clearly, you've heard what government says they will do. You're not satisfied. But let's see, between now and the end of the week, if anything will change. But meantime, well, if you're out there and you want to help in any way possible with the logistics, be it the food, the medical supplies or anything, you can help. Clearly, from what government tells us, they are trying to look for the funds to do it. But meantime, for the safety of these nurses, let's not leave things to chance as they are. If you can contribute, do that from the goodness of your heart to do that. But thank you so much for coming today. Between now and then, let's see what happens in the coming days. We'll go for a short break now. When we come back, we'll talk about other issues to do with what's been happening on the campaign trail, as well as the new bill that's been passed in Parliament to deal with classification of filming. We will delve into that a bit more after the break. Stay with us.